Congresswoman Pramila Jayapal, and I'm so proud to serve Washington's 7th Congressional District in the House of Representatives, where I also serve as the chair of the Congressional Progressive Caucus. It is no secret that our healthcare system is broken. There's a major problem in our country when cancer rates spike at 65 simply because seniors can finally afford to see a doctor when their Medicare coverage begins. And although Medicare is critically important to our healthcare system, it is under major threat today. Let me be clear. I will fight any effort to privatize Medicare tooth and nail, whether it's the ACO REACH program, direct contracting, or taking on Medicare Advantage, because that is exactly what ACO REACH is. It's Medicare privatization hidden in layers of bureaucracy. And ACO REACH has no size limit, meaning that tens of millions of Medicare beneficiaries can be funneled into the program before we know for sure what it will mean for patients. But we certainly have a good idea of how it'll look. Studies show that seniors consistently receive worse care under Medicare Advantage compared to traditional Medicare. These profit-driven entities are encroaching on Medicare and our entire healthcare system, aiming to make money from both patients and off of the federal government. And as of now, Medicare is letting them because of this Trump-era program called ACO REACH. That will only lead more patients to having their claims denied, more necessary treatments being missed, and more patients falling through the cracks. That is why the Progressive Caucus is calling on the Biden administration to fully end this outrageous privatization program. In just a moment, you'll be hearing Rick Timmons' story, one that highlights exactly why we cannot let Medicare be sold to the highest private equity bidder. So thank you all for your activism to protect traditional Medicare. And please know that we are making progress and we will get this done together.
Thank you, Representative Jayapal. Now that we know about ACO REACH and the threat that it poses to Medicare, I want to share a couple of stories with you that demonstrate why it's a problem to have for-profit companies have a stake in medical decisions. When I first enrolled in Medicare, I chose Medicare Advantage because it seemed like it was a better deal than original Medicare. I soon had occasion to doubt that decision. I had a knee injury that began to progress into a need for a knee replacement. My doctor referred me to a very well-known surgeon at the University of Washington, but the Medicare Advantage plan denied that referral because he was not in their network. If it was not in their network, that meant it was not a financial benefit to them. That was when I became painfully aware of the fact that the financial interests of the for-profit companies were going to trump my choices for my own providers. That was only the beginning. A couple of years later, I discovered a small lump in my ear that was rather painful, and my doctor suspected a melanoma. Now, if you're familiar with melanomas, you know that effective treatment requires immediate diagnosis and treatment. So my doctor immediately sent in the request for a referral to a dermatologist who actually was in the network for the Medicare Advantage plan. However, we waited 5 months of frequent phone calls, repeated emails, resubmissions of the request for the referral by my doctor before the insurance company responded, at which point they explained that the delay was due to restructuring for purposes of improving efficiency. I interpret that as meaning making more money. So here it is now, 9 months after the original request for the referral, and I'm recovering from major surgery to remove a malignant melanoma and to explore lymph nodes to see if there was metastases. Because of the aggressive nature and the size of the tumor, which is related to the delay imposed by the insurance company, I'm now waiting to begin immunotherapy. So I'm not the only one who suffers from delays and denials by insurance companies when it's not in their financial interest. Because basically we know now that if it comes to choosing profits over medical care for patients, the insurance company's profits will always predominate. ACO REACH is not the same as Medicare Advantage. but they both allow for-profit companies to have a say in the medical care and medical decisions of beneficiaries. I learned what this means the hard way. And now you have a chance to avoid experiencing the same thing that I did. Karen Richter, the co-president of the Puget Sound Advocates for Retirement Action, will tell you what you can do to prevent experiencing the same thing that I did and how to protect yourself and your family from Medicare privatization.
Thank you, Rick. Now here's what you can do to stop the privatization of Medicare. Go to PSARA.org and sign on to our letters to President Biden and our congressional delegation. You can use this video to convince your organizations to sign on our campaign by signing our letters. You can ask your organizations to have their members sign our letters, and you can call President Biden at 202-456-1111 and your representative and senators at 202-224-3121 and ask them to terminate the DCE ACO REACH programs. You can send our template letter to 10 of your friends with a link to this video, asking them to sign our letters. And finally, join PSARA on July 30th for a National Day of Action to say no to the privatization of Medicare. Watch our website for more details. And thank you all for your activism. We won't stop until these programs are terminated.